Okay, so you're getting ready for an audiologist interview.
Wow.
Yeah, and it's a career that's both in demand
Absolutely.
and super fascinating.
It really is.
Um, we are going to do a deep dive
Okay.
into how to just nail this interview,
Great.
going way beyond your typical interview prep. And
Awesome.
we'll be using some sample interview questions today.
Sounds good.
And we're also drawing insights from the RoleCatcher Career Guide.
That's a great resource.
It is. And of course, we will also be touching on how RoleCatcher's AI can help you tailor like the perfect answers.
AI is changing the game.
Yeah, it really is. It's pretty amazing.
Yeah.
So audiology is a field
Mm-hmm.
with a lot of depth.
A lot of depth, a lot of opportunity as well.
Exactly. The Bureau of Labor Statistics predicts a 15% growth
Wow.
for audiologist jobs by 2029,
That's huge.
which is, yeah, that's huge. That's a lot of growth.
Yeah.
Why do you think that is what's driving that demand?
I think, well, a big factor is the aging population. You know, as people get older, age-related, hearing loss becomes more common.
Of course.
And then we're also seeing just more awareness about hearing health in general,
Right.
which leads to earlier diagnosis and treatment.
Which is fantastic.
Yeah.
So let's dive into some of these common interview questions. I know they can be a little nerve-wracking.
Oh, for sure.
So let's break them down one by one.
Okay, let's do it.
Are you ready to tackle the first one?
I am fire away.
All right, here it is. Tell us about your experience in audiology.
Okay.
This one seems pretty straightforward, but I bet there's a lot more to it than just listing your previous jobs, right?
Yeah, you're absolutely right. This question, it's like an open invitation to show your passion for audiology and highlight the skills that are most relevant for the role you're interviewing for.
That makes sense.
So it's not just about your past, it's about showing them you understand what it really takes to be a successful audiologist.
I like that. And the RoleCatcher Guide actually mentions 3 key skills that are super important.
Okay.
Reading comprehension, active listening, and social perceptiveness.
Those are spot on.
Those are very, very key in this field. But how would you suggest someone weave those into their answer?
Don't just say that you have the skills, right? Think of specific anecdotes or examples that bring those skills to life.
Okay.
For example, maybe you had a really complex case where you had to analyze audiograms and research papers to come up with the best treatment plan.
Ooh.
So that's reading comprehension in action.
I like it. I like it.
Or a time when you had a patient that was really frustrated or anxious about their hearing loss.
Right.
How did you use active listening
Yeah.
and social perceptiveness to make them feel heard?
Oh, that's a good one.
Yeah. So it's all about painting a picture with your words and showing the interviewer that you truly understand what it takes to be an effective audiologist.
Awesome. Okay, let's move on to question number 2.
All right.
What do you consider to be the most important skill for an audiologist?
Ooh.
I feel like this is a little bit of a trap.
Yeah, it can be a trap if you're not prepared,
Right.
because a lot of people might just pick a skill and go with it. But there's a more strategic approach. I think you want to connect your chosen skill to the employer's values.
That's a really good point. How do you figure out what their values are?
Do your homework research the specific company or clinic you're interviewing at?
Okay.
Look at their website, their mission statement,
Yeah.
any recent news articles about them. What are they emphasizing?
Interesting.
Is it patient-centered care? Is it cutting-edge technology? Is it community outreach?
Okay, so let's say they talk a lot about patient care.
Okay.
What skills would you highlight in that case?
You want to focus on things like therapy and counseling or customer and personal service. You know, you're showing them that you understand their priorities
Right.
and that your skill set aligns perfectly with what they're looking for.
That's smart.
Yeah.
All right, on to the dreaded question number 3.
Oh, boy.
How do you handle difficult patients? This one always makes me nervous just thinking about it.
I get it's not the most fun question to answer,
Yeah.
but it's a reality of any healthcare field.
Sure. And honestly, I think it's a fantastic opportunity
Okay.
to showcase your empathy and your professionalism.
Oh, that's a really good way to look at it.
Yeah.
So how do you actually answer this one without sounding robotic or rehearsed?
Think about a specific example where you successfully, navigated a challenging patient interaction.
Okay.
The RoleCatcher Guide has some great career stage profiles. And one of the junior audiologist profiles has a perfect example.
Okay.
They talk about a patient that's in denial about their hearing loss.
Oh, that's a tough one.
Yeah, but they handle it beautifully. They focus on empathy and active listening instead of arguing with the patient or, dismissing their feelings. They acknowledge their concerns and reframe the conversation around, understanding their lifestyle and their communication needs.
I bet that made a huge difference.
Yeah, it's all about finding that balance between being empathetic and maintaining professionalism.
That's right.
Yeah.
So this profile actually gave like a concrete example
Exactly.
of how to do that. Yeah. It's one thing to say you can handle difficult patients, but it's much more impactful to actually share a story that demonstrates those skills in action.
I like that.
Yeah.
Okay.
Yeah.
Let's move on to another tricky question.
Okay.
How do you stay current with developments in audiology?
Ooh, that's a good one.
This field is constantly evolving, so it's crucial to show that you're committed to lifelong learning.
Absolutely. Interviewers want to see that you're passionate about staying on top of your game and that you're genuinely interested in the latest advancements in audiology.
Yeah, what are some things that you do to stay current?
I'm a big fan of online courses and webinars.
Oh, yeah, those are great.
They're super convenient. You can learn about new technologies and techniques without having to travel.
Right.
And of course, being an active member of professional organizations like the American Academy of Audiology is essential.
I try to attend conferences whenever possible, and I subscribe to a couple of key journals,
That's great.
like the Hearing Journal in Audiology Today.
Yeah, those are great resources.
Yeah, they're great for keeping up with the research and best practices.
Absolutely.
And don't forget to mention any recent workshops or courses or conferences you've attended.
Right.
It shows the interviewer that you're actively investing in your professional development.
Exactly. And don't be afraid to get specific. Like if you attended a webinar on a new hearing aid technology, talk about what you learned and why it excites you.
Right.
The more specific you can be, the better.
Okay, I think we have time for one more question before we take a quick break.
All right.
This one is all about communication skills. Describe a time when you had to explain a complex audiology concept to a patient or family member.
I love this question.
Yeah.
It's so important.
It is, because you're not always talking to other healthcare professionals.
Exactly.
You need to be able to break things down in a way that anyone can understand.
Yeah. And this is where your ability to connect with your audience really comes into play. Think about a time when you had to explain something like a shearing test, or different types of hearing loss, or how a cochlear implant works.
Did you use analogies or visuals to make it easier to understand?
Oh, that's a great strategy. Analogies and visuals can be incredibly helpful.
Yeah.
Especially when you're dealing with complex medical concepts.
Right. Maybe you drew like a simple diagram.
Yeah.
To illustrate how sound travels through the ear.
Exactly.
Or use like a familiar object to explain the size and function of a cochlear implant's components.
Exactly. It's about finding creative ways to make the information accessible and engaging. And remember, it's okay to check for understanding along the way,
Right.
Ask things like, does that make sense? Or do you have any questions about that?
Do you have any questions? Yeah, it's so important to make sure everyone's on the same page.
Absolutely.
All right, let's take a quick pause here when we come back. We'll tackle some more interview questions and delve a little bit deeper into how RoleCatcher's AI can help you craft those winning answers.
Awesome. Can't wait. Welcome back. I'm sure you are finding these interview tips super helpful.
Yeah.
As you're preparing for your audiology interview, we've covered some tricky questions so far.
We have.
How are you feeling?
Feeling pretty good. Like I'm starting to get a real handle
Good.
on how to approach these questions.
Awesome.
And I am especially excited to dive into RoleCatcher's AI.
Okay.
It sounds like a game changer for interview prep.
It absolutely is. RoleCatcher can make your prep so much more targeted and efficient.
Oh.
It's like having a personal coach.
Oh, wow.
That analyzes job descriptions and gives you personalized feedback on your answers.
Okay, color me intrigued. Break it down for me. How does it work?
So it starts with understanding the specific skills employers are looking for in each role.
Right.
You know how job descriptions can be full of jargon and buzzwords?
Oh, yeah?
Well, RoleCatcher's AI cuts through all of that.
Okay.
And pinpoints the exact skills that matter most for that particular job.
That's so helpful.
It is.
I've definitely struggled with deciphering job descriptions before.
I know.
It's like they're speaking a different language.
It is, but RoleCatcher takes all of the guesswork out of it.
Okay.
It tells you exactly what the employer is looking for, so you can tailor your resume and your answers to hit all the right notes.
So it's not just about generic interview tips.
No.
It's about making sure your answers align perfectly
Exactly.
with the specific job you're applying for.
That's what makes RoleCatcher so powerful.
Wow, this is blowing my mind a little bit.
I know, it's pretty cool.
So once you've figured out those key skills, what's the next step?
You get to practice your answers.
Okay.
So you can actually type in your responses to common interview questions,
Okay.
and RoleCatcher's AI will give you feedback.
Wait, seriously?
Yes.
So it's like having a virtual interview coach
It is.
who critiques your answers.
Exactly. It can tell you if you're being too vague, if you need to provide more specific examples, or even if your phrasing could be stronger.
That is incredible. It's like having a secret weapon in your back pocket.
It is.
Okay, so let's say you've used RoleCatcher to analyze the job description. You've practiced your answers, and you're feeling pretty confident. What else can you do to really nail the interview?
Well, there's one more feature of RoleCatcher that I think you'll love.
Okay.
Video practice with AI feedback.
Hold on.
Yeah.
You're telling me I can record myself answering interview questions and get AI feedback
Yes.
on my delivery?
Isn't that amazing?
Sign me up.
It analyzes your facial expressions, your tone of voice, even your body language.
Wow.
And it gives you personalized suggestions for improvement. It's like having a personal stylist for your interview presence.
Okay, that is next level. I'm a very visual person.
Yeah.
So the idea of being able to see myself,
Yes,
answer these questions, and get that kind of targeted feedback is a game changer.
it really is. And I think it addresses a concern a lot of people have about, feeling overwhelmed during interview prep.
Right.
With RoleCatcher, you're not just getting generic advice. You're getting personalized feedback that's tailored to your specific needs and the specific job that you're applying for.
I love that it's all about working smarter, not harder.
Exactly.
Okay, let's get back to those interview questions.
Okay, sounds good.
We left off with communication skills. Let's see what's next on the list.
All right, the next question is, how do you manage your caseload effectively?
Okay.
So this one is all about showcasing your organizational skills
Mm-hmm.
and your ability to prioritize tasks.
Okay.
As an audiologist, you're likely going to be juggling appointments, paperwork consultations, maybe even research or teaching responsibilities.
Wow, that's a lot.
It's a lot. So it's important to demonstrate that you can stay on top of everything.
This is a great question. I'm pretty good at organization,
Okay.
but I could definitely see how this could be challenging in a fast-paced healthcare setting.
Oh, for sure.
What are some tips for answering this question effectively?
Think about the specific strategies that you use to stay organized and efficient. Do you have a particular scheduling system that works well for you?
Mm-hmm.
Do you prioritize tasks based on urgency or complexity?
Right.
Do you have a method for tracking patient progress or ensuring that all necessary documentation is completed promptly?
I use a color-coded calendar system and a task management app to keep track of everything.
Oh, that's great.
It helps me visualize my workload, make sure that nothing falls through the cracks.
I love that. What about you? Do you have any go-to organizational tips?
Oh, for sure.
I am a big fan of using checklists and templates.
Oh, yeah.
They help me standardize my workflow and ensure that I'm consistently following best practices. And I always try to schedule time for administrative tasks, even when my schedule is jam-packed.
That's smart. It's
Yeah.
so easy to let those administrative tasks pile up, but it's important to stay on top of them.
It is.
And don't forget to mention your ability to adapt to changing demands and handle unexpected situations.
Yes.
Flexibility is key.
It is in any healthcare setting.
Yeah, for sure.
So if you have examples of times when you had to adapt to a sudden change or juggle multiple priorities, definitely share those.
Okay, good advice.
Yeah.
All right, let's move on to a question that's especially important in healthcare.
Okay.
How do you ensure patient confidentiality?
Mm-hmm.
I know HIE is a big deal in this field,
It is a big deal.
but I'm not sure I fully understand all of the ins and outs. Can you give me like a quick refresher?
Sure. HIA stands for the Health Insurance Portability and Accountability Act.
Okay.
It's a federal law that protects the privacy and security of patients' health information.
All right, that makes sense. So how does HIA actually play out in a real-world setting?
It means that you need to be extremely careful about how you handle patient information.
Okay.
You need to be using password-protected systems for storing electronic health records.
Right.
Ensure that you have private consultation rooms for discussions with patients and have protocols for securely disposing of confidential documents.
So it's not just about being discreet.
Yeah.
It's about following specific procedures to protect patient privacy.
Exactly, at every level.
Okay.
So when you're answering this question, you want to demonstrate that you understand the importance of HIPAA and that you're committed to following those regulations meticulously.
That's really helpful. Thanks for clarifying that. Okay, let's move on to a question that's a little more introspective.
Okay.
What do you think is the most challenging aspect of audiology? I feel like this one is really about getting to the heart of what it means to be an audiologist
Yeah.
and showing that you understand the complexities of this field.
You're right on the mark. This question is an opportunity to reflect on the challenges that you've encountered in your experience or the issues you've observed within the profession. But it's also a chance to show how you approach those challenges
Yeah.
and what you've learned from them.
I imagine working with pediatric patients could be particularly challenging.
Oh, for
They
sure.
might have difficulty communicating their needs, and you need a lot of patience and creativity to
Right.
figure out how to best help them.
That's a great point. Working with children who have hearing loss can be incredibly rewarding,
Yeah.
but also very demanding. You need to be able to build trust and rapport with both the child and their family, and you need to be comfortable working as part of a multidisciplinary team.
Right. What about delivering difficult diagnoses? That must be emotionally challenging,
It can be.
especially when it involves a significant lifestyle change for the patient.
Definitely. But it's also a chance to really demonstrate your empathy and your counseling skills. You need to be able to deliver the news in a way that's sensitive and compassionate,
Right.
and be able to provide support and resources to help the patient cope with the diagnosis.
It's all about meeting the patient where they are or helping them navigate
Yes.
what can be a really difficult and emotional experience.
Exactly. And it's important to remember that you're not alone in this. You have colleagues, mentors, and professional organizations to support you.
Speaking of colleagues, let's talk about teamwork. Audiologists often work as part of a larger healthcare team. So interviewers will likely ask, how do you approach interdisciplinary collaboration with other healthcare professionals?
Great question.
What kind of teamwork have you had to do in your previous roles?
In my previous role at a hospital, I worked really closely with ENTs,
Okay.
speech-language pathologists, and even educators.
Wow.
We had regular meetings to discuss patient progress and share insights, and we developed shared documentation systems to ensure that everyone was on the same page.
That sounds like a really collaborative environment.
It was.
I've noticed that communication can be a challenge when you're working with people from different disciplines.
Oh, yeah.
Everyone has their own jargon and way of doing things.
It's so true, but open communication and active listening are key to successful interdisciplinary collaboration. It's all about being respectful of each other's expertise
Right.
and working together to achieve the best possible outcome for the patient.
That makes perfect sense. What are some other tips for answering this question effectively?
Think about specific examples of times when you successfully collaborated with other professionals.
Okay.
How did you ensure clear communication? Did you utilize shared documentation systems? Did you proactively schedule meetings to discuss patient progress?
Yeah.
Did you organize joint training sessions to enhance interdisciplinary understanding of each other's roles and expertise?
That's a great point. Having concrete examples to share really helps bring your answer to life
It does.
and shows the interviewer that you have real-world experience with teamwork and collaboration.
Exactly. And don't forget to mention your ability to build rapport and establish positive working relationships with people from different backgrounds and disciplines.
Those are all fantastic tips.
Yeah.
I feel like I'm starting to get a real sense of how to approach this question now.
Good. I'm glad.
Okay, I think we have time for one more question before we wrap up this section.
All right, let's do it.
What do you think is the future of audiology?
Oh, good one.
This one always throws me off a bit.
Yeah.
Seems like such a broad question.
It is a broad question, but it's also a really important one.
Okay.
It's a chance for you to showcase your vision and your ability to think critically about the evolving landscape of the profession.
Okay.
To prepare for this one, it's essential to stay informed about emerging technologies and trends in audiology.
Like what are some of the big things happening in the field right now?
Well, telehealth is becoming increasingly popular, especially in rural or underserved communities.
Yeah.
It allows audiologists to provide remote care to patients who might not otherwise have access to these services.
That's amazing.
It is.
It sounds like telehealth could really revolutionize the way audiological care is delivered.
Absolutely. And then there are the incredible advancements happening in hearing aid technology.
Oh, yeah.
We're seeing more personalized and sophisticated devices that use artificial intelligence and machine learning to adapt to individual hearing needs.
Wow, that's incredible. It sounds like technology is playing a huge role in shaping the future of audiology.
It definitely is. And there's also a growing awareness of the importance of early intervention and hearing conservation. We're seeing more initiatives aimed at identifying hearing loss in infants and young children, and there's a greater emphasis on protecting hearing health throughout the lifespan.
That's so important.
It is.
Early intervention can make a world of difference
Absolutely.
for children with hearing loss.
Yes. So when you're answering this question, you want to demonstrate your understanding of these developments and express your enthusiasm for the future of audiology.
Okay, so it's not just about knowing the facts.
No.
It's about showing that you're passionate about the field
Yes.
and excited about the possibilities.
Exactly. Enthusiasm and a genuine desire to learn and grow are incredibly valuable qualities in any profession,
Yeah.
especially one that's as dynamic and evolving as audiology.
I love that it's all about showing that you're not just looking for a job.
Right.
You're looking to be a part of something bigger
Yes.
and contribute to the advancement of the field.
Yes. Precisely. Now, I know we've covered a lot of ground here,
We have.
but there are still a few more essential tips
Yeah.
that can really help you shine in that interview. Are you ready for the final act of our audiologist interview deep dive?
Bring it on. All right, back for the final act.
Right.
Feeling like I could walk into that interview right now and just ace it.
I love that attitude, and we've still got a few more pro tips to really solidify that confidence.
Bring them on. I'm all ears.
Let's talk about storytelling.
Okay.
I know we touched on it earlier, but it is so crucial for making your answers memorable.
I agree. Anybody can list skills on a resume,
Right.
but a good story really brings those skills to life.
Yes, it makes you stand out as a person, not just another applicant.
Exactly.
Yeah.
So what kind of stories should I be thinking about?
Stories that highlight your passion for audiology, your problem-solving abilities, your empathy for patients. Those are the gems.
Yeah, those are good ones.
Mm-hmm.
Maybe a story about a time you went the extra mile to help a patient who was struggling with their hearing aids.
Perfect. Or a time you worked with a team to come up with a creative solution for a challenging case.
Yeah.
Those stories show the interviewer what you're really capable of.
Okay, so stories are a big one.
Mm-hmm.
What else have you got?
Body language?
Oh.
You could have the most perfect answers.
Right.
But if your body language is saying, I'm terrified,
Oh, yeah.
it's going to undermine all your hard work.
I've definitely been there.
Yeah.
Nerves can get the best of us.
I know they can, but that's why practice is so important. Pay attention to your posture.
Okay.
Make eye contact.
Mm-hmm.
Try to relax.
I like that it's not about being somebody you're not. It's about letting your genuine self shine through. And a smile always helps.
Absolutely. A
Well,
genuine smile can work wonders.
For sure.
And don't forget to listen actively.
Well, that's a good one.
Nodding, making eye contact, asking clarifying questions shows that you're engaged in the conversation.
It shows you're genuinely interested in what they have to say, not just waiting for your turn to talk.
Exactly. Now, here's a bonus tip that I think a lot of people overlook. Ask thoughtful questions.
Oh, good one. This is your chance to show them that you've been paying attention and that you're genuinely curious about the position.
Yes. It's not just about them interviewing you, it's about you interviewing them as well.
So what kind of questions should I be asking?
Think beyond the basics, like salary and benefits. Ask about the team culture, their approach to patient care, the opportunities for professional development, things that really matter to you.
You could even tie your question back to something the interviewer mentioned earlier.
Yeah.
Like if they talk about a new program the clinic is launching, you could ask about your potential role in that.
Exactly. It shows you've been listening and you're thinking ahead.
That's really smart. I think we covered just about everything.
I think so too.
I'm feeling incredibly prepared thanks to you.
You've got the knowledge, you've practiced your answers, you're radiating confidence. I have no doubt you're going to rock that interview.
Thank you. But before we officially wrap up, let's touch on one final thought-provoking point from the RoleCatcher Guide.
Okay.
In the Future of Audiology section, they ask this question.
Okay.
How do you envision technological advancements impacting the accessibility of audiological services, particularly for those in remote or underserved areas?
That's a great question to consider.
It is.
It goes beyond just landing the job.
Right.
It gets you thinking about the bigger picture of audiology.
It shows the interviewer you're not just thinking about yourself, but the social impact of this work and how it can reach more people who need it.
Right. Think about the potential of telehealth, mobile clinics, even AI-powered diagnostic tools.
Yeah.
These advancements could be game changers for people who might not have easy access to traditional audiology services.
There's so many possibilities. It's inspiring to think about how this field is evolving and how we can be a part of that positive change.
That's what it's all about.
Yeah.
So go out there, showcase your passion, your skills, and know that you have the potential to make a real difference in people's lives.
Best of luck with your interview. I know you're going to do great.
Thank you. And remember, even if you don't get this specific job,
Every interview is a valuable learning experience.
True.
Keep refining those skills. Keep that passion burning, and the right opportunity will come along.
That's great advice. Thanks for joining me today.
It was my pleasure.